Okay, so today we're going to talk about mixing and administering IM medications. And before we do that, before I get my supplies, I would have cleaned my table with disinfecting wipes. And that was already done, and there is another video that demonstrates how to do that. So the next thing we're going to do is talk about intramuscular injections or IM injections. And what we do know is an IM injection is what we call a controlled act as per the Regulated Health Professions Act. And so it is a sterile procedure and it requires knowledge, skill, and ability to administer. What's important to know is that in order to administer a controlled act like an IM injection, we need to have a doctor's order, and we would also need the medication record. So for Noelle Smith, we have a doctor's order for IM Gravol, 25 to 50 milligrams, as needed every 4 to 6 hours. And Noelle Smith is feeling a bit nauseated, so we're going to give her 25 milligrams to start. So, before we administer the medication or prepare it, we need to remember that the College of Nurses of Ontario identifies 8 medication rights that we must have before we can move forward with administering. And they are the right client, the right medication, the right reason, dose, route, frequency, site, and time. In addition, your Canadian Fundamentals textbook that combines frequency and time as one of those 8 also adds 2 other important rights, and they are the right education for the patient about the medication and the right evaluation after giving the medication in terms of the effect it has had on the patient. So again, an IM or intramuscular injection is a sterile procedure, and we need specific equipment. So we have our doctor's order, we have our medication record. In addition, we would need a syringe. And because we know we're only going to give a small amount of medication to Noelle, we would get a 1 ml syringe. In addition, we will need the needle that we're going to use to administer it, and we're going to need a filter needle to draw the medication up with, and of course we're going to need the medication. Gravol actually comes in an Ampoule, which is a sterile glass container that needs to be broken so that the medication can be withdrawn from it. Sometimes medications that are in ampoules come with an actual label on it, but this one is embedded in the glass of the medication because Gravol tends to be a stock medication on most units in most agencies. So to begin with, we have all our equipment, and we have our alcohol swabs, and we have our Sharps container, our doctor's order, and our med record. So I'm going to complete my hand hygiene before I begin mixing. And the first thing I'm going to do is break open the ampoule. So if you can see, there is some medication up in the neck of that ampoule of Gravol, and we want to make sure all of it is in the bottom portion before we break open the ampoule. So one way to do that is to flick the ampoule. You can actually use a pen if you don't want to use your finger, or another way is to shake the ampoule so that the medication goes down to the lower portion. Now, the ampoule has a scored ring around the neck of it, and it's usually quite colored. Here it's blue, and it needs to be broken open and away from you. So one way to do that is to just snap it away from you, make sure that your thumb and your fingers don't touch the broken glass portion. One other way when people are nervous about breaking it open is to use an alcohol swab or a gauze or something like that, and you can put it over top of the top part of the ampoule and then snap and break it away, always making sure that the top portion goes into your Sharps container. So this is glass at the top, so we have to be careful not to injure ourselves, but also that's sterile. So we've broken that open, and what we have is Gravol 50 milligrams per mil, and so we're going to give half a mil. So we take our syringe, and then we have our filter needle, which is usually a long 1.5-inch needle, and it's usually a gauge of a lower number, so 18 or so. It's quite large in diameter, that needle, so it allows us to draw up any kind of medication, especially if that liquid is viscous. Needles are sterile and stainless steel. So we're going to remove our cap, and just looking at that filter needle, you'd notice that you would never want to actually inject this needle into somebody's skin. At the top of the needle, this is the shaft part, and at the bottom part that attaches to the syringe is called the hub, and at the top part is the bevel of the needle, and that has the opening in it that we can use to draw up the medication. So I'm going to put my needle into my ampule, and I can then begin to draw up my medication. So I'm going to draw up half a mil. So I have just a little bit over half a mil of medication in here. I'm going to put my glasses on so that I can see exactly how much. So what I like to do is pull the plunger down just a little bit to make sure that I have exactly 1/2 mil, and so that there is no medication in the neck of that needle. Now I have to take this needle off and put the needle that we're going to use to administer with on. So I don't want to recap that needle by putting my hand. I use the table to recap this needle. I make sure it's clicked on, and then I remove it like this and put it in the sharps container. Then I'm actually going to secure my new needle that I'm going to inject with to the end. Okay? And what's important to know is that we're going to move the medication up now, making sure to knock out any bubbles so that what we're administering is completely medication and not air. And we're going to prime our needle. To 1/2 mil. And that's that. So we're ready to go and inject.